This is Catherine Galloway, and I am presenting on the effects of chronic mental illness on parenting. Um, Child maltreatment is a complex issue, as we all know, and Sacchetti points out that there's not a common definition. She says that it's a legal matter defined by social service systems rather than by scientists or mental health professionals. That has added complexity to the issue. So child maltreatment has all these different systems that really kind of play into the how to handle it, and yet there's not one unifying definition of what child maltreatment is. So that kind of makes it get a little murky. And so that lack of consensus on a definition of maltreatment has hindered the identification and treatment of child maltreatment. And then also when you take into the historical and cultural differences of parenting styles, it increases the complexity of the issue. So just starting out of the gate, child maltreatment is complex, not even taking into account the mental health of a parent. So there are many risk factors that lead to child maltreatment that we all are aware of, and predictors of child abuse. And parents with mental illness are at risk for abusing their children. But this is a really important note, that parents with mental illness alone is not a strong predictor of child abuse. So just because a parent has anxiety or depression or is, schizophrenic or any of those things, does not mean that they're going to be more likely to abuse their child. But when that mental illness is combined with other risk factors, that is when we really want to take note as practitioners and pay attention to what those other risk factors are, coupled with the mental illness, because those things can really increase the risk of child maltreatment. So Sacchetti further notes that because no single risk factor or set of risk factors has been identified as providing a necessary or sufficient cause of maltreatment, a number of interactive etiological models have evolved that consider a combination of individual, familial, and environmental factors that may contribute to the occurrence of child maltreatment. And then also there's internal and external factors that play roles in the risk of child maltreatment. So the parents' internal factors, their emotions, their mental illness, their social history, things that affect them internally, combined with their external factors. So negative social factors, poverty, lack of housing, lack of job, education status, those kinds of things. The internal and the external factors, those negative factors will increase the risk of maltreatment considerably. So all kinds of risk factors can lead to increased chances of child maltreatment. But there are 5 risk factors that have been identified that are significantly predicative of current child abuse and neglect. And those are a parent or both parents being under the age of 21, financial problems, mental illness or depression treatment of the parents, single parents, and an adult in the home who is violent. So not necessarily one of the parents, but any adult who is violent and that is living in the home. So like I was saying, this shows that while mental illness alone is not a predictor of child abuse, but when it's combined with other risk factors, especially these 5 that I've listed, it should be taken very seriously as a risk factor for potential child maltreatment. There also tends to be intergenerational cycle of child maltreatment. So maltreated children are at increased risk for developing an array of behavioral problems, major mental disorders, and personality disorders. And so when those children grow up and they become parents and then they face child maltreatment and maybe they've developed mental disorders, behavior problems, or just aren't very good at coping because they had adverse childhood experiences growing up. So then they may repeat this cycle of mental illness and child maltreatment. Mental illness has a great stigma around it, as we all know. It can affect any person regardless of gender, age, race, socioeconomic status, or other identifying characteristics. So mental illness really cuts across all cultures, all demographics, and things like that. So there's not really one specific population that it affects. And I thought this was an interesting statistic that really honed in on it, is that globally approximately 60% of women with enduring mental health difficulties have children under 16 years of age. So that kind of gives us an idea of how that really affects so many people, especially parents, specifically women, how mental illness affects them across the globe. Mental illness is often compounded by other factors. Individuals with mental illness are more likely to suffer poverty, stigma, social isolation, unemployment, and poor physical health. And like I said earlier, these factors alone can impact effective parenting or any individual, but combined with mental illness, these factors really drastically increase the risk of child maltreatment. So looking back on how really the care for the mentally ill in the United States has been since about the late 1800s. So prior to the 19th centuries, families really cared for the mentally ill on their own. Most people were on rural farms or kind of separated. They weren't concentrated within villages or towns or cities or anything like that. So if there was a mentally ill member of your family, you just took care of them. And then as the industrial age took root, populations were more condensed in the cities. The mentally ill were perceived as threats, and asylums then became a way to handle the mentally ill. So while the rich maybe had the resources to send off their mentally ill family members to private doctors who housed smaller groups of mentally ill, really most of the mentally ill population found themselves involuntarily held in public hospitals and asylums. The conditions were dire, as we've all probably heard about. Patient maltreatment was really rampant, and exploratory treatments were the norm. And also, I'd like to note the staff that worked at these asylums were often like underpaid, undervalued, and so, as you can imagine, they would then treat their clients, the mentally ill, not well either. So it was just really a bad situation all around. By 1890, every state had built one or more publicly supported mental hospital, which they all expanded in size as the country's population increased, which makes sense. So really, these mental hospitals were popping up everywhere and were growing, and were really just becoming a place to house these mentally ill patients. And they weren't really receiving the care or effective treatment that was needed. And then the decrease in these state-run hospitals only started to occur when new treatment methods were developed in the 20th century, and then along with the rise of advocating for justice for the mentally ill. So we still live with the ramifications of the stigma of mental health in our society today. It's still, it's slowly becoming better, but it's still something that people don't like to talk about. Mental illness is a secret a lot of times, and only later do we find out that somebody was dealing with depression, maybe after their suicide or something like that. So mental illness has a strong stigma that produces shame and misunderstanding. So as a result, treatment and resources are not as readily available as they could be. And then think about if you were a parent that had a mental illness and you really needed to seek treatment, but you're terrified that saying, being diagnosed or seeking treatment for being bipolar would lead to your child being removed from your home. So this fear is great among these parents that have a mental illness, and it discourages them from seeking services and support sometimes. And social isolation, of course, can make mental illness much worse, and combine that with those other risk factors that I brought up earlier, and the chances of maltreatment go up. So we don't understand the full set of implications that families with one or more parents that have mental illness, and more resources need to be developed in order to support these children and families. So here are 3 different kind of resources that are available right now in this day and age. So the first is Healthy Families America, and you can click on each of these titles and it will take you to the websites. But Healthy Families America, which I'll also touch on later, is a national evidence-based home visiting program model, and it's designed to work with overburdened families who are identified to be at risk for adverse childhood experiences, including child maltreatment. So by taking an assessment, they will understand if parents and families are at risk for child maltreatment, and then they will start a home visiting program. It's really proven to be quite effective, and and the research and evidence base of it is really good. So, like I said, it's in over, I think it's over in over 35 states right now, and a really proven and effective program. Another way to support clients is support groups for parents and caregivers. One such is Parents Care and Share support groups. So in Illinois, that's where I'm at, Parents Care and Share groups are administered by the Children's Home and Aid Society of Illinois. So parents going through similar situations, maybe they've also been dealing with mental health issues or things like that. But Parent Share and Care groups can really provide that camaraderie or that support system, and just knowing that somebody else has also gone through something similar. And so the Parents Care and Share group, or any kind of parent support group of other parents that are going through similar situations, can be really useful. And then something that's local here, but also crisis nursery, Mini Oberlin Crisis Nursery is local to where I'm at in Springfield, Illinois, but crisis nurseries are all over the country. This crisis nursery provides free emergency care for children whose parents are facing any type of crisis. So basically, no questions asked, but you can drop your child off 24 hours a day, 7 days a week, 365 days a year. And then it's just a really supportive, loving, caring environment. And then once a family's kind of hooked into the services with the crisis nursery, they're often provided further support services. So parent education classes, both in-home or at the nursery, counseling support groups, referrals to other services or healthcare providers, advocacy, and all kinds of things. So if I were working with a client, and these are the interventions that I would work with them. So depending on who my primary client is, kind of depends on how I will drive my assessment and intervention. If I'm working with the parent, I'll kind of do some things differently than if I were working with just the child. So there is a great need for a comprehensive screening tool for practitioners to use to assess the risk factors known to contribute to child abuse. So there's a need for screening tools, but I would, if I were practicing with a child or a parent, I would want to assess the situation, kind of look at those risk factors, interview them, and understand their situation. Completing a family history will be really telling to understand the family history of mental illness and child abuse, and those other risk factors, really. And like I mentioned earlier, parents abusers' children are at a higher risk of abusing their own children, especially when coupled with a mental illness in the parent. So, as I said earlier, child abuse can lead to mental illness, so the family history will be important for both aspects. A family assessment will be helpful, and including as many family members as you can in the assessment too. Continuing with the micro-intervention, I kind of alluded to this earlier, but families are already leery of child protective services, so they may not fully disclose their mental illness to us as child welfare workers. And if they're not comfortable enough or don't feel like they can safely disclose mental illness, we aren't able to provide the adequate supports if we're not aware. So that kind of makes it a tricky situation, and a more reason to be an advocate for them and really develop that therapeutic alliance so that they can feel comfortable in really giving a truthful family history. So it's important to provide interventions specific to the parents with mental illness that serve the families without triggering those unnecessary risk assessments or statutory investigations. So just because a parent identifies as having a mental illness, we don't need to already jump to those conclusions that the child's in danger and we need to get them out of the situation. We need to jump to the conclusion that we need to provide them services and supports and everything that we can to support the children and the parents. So effective interventions for the children and parents are ones that provide psychological and emotional support to the children, and really helping them understand this mental illness that their parents are dealing with, and how it affects them and relates to them, the parent and the child. There's a great need for the children to be heard and understood in these situations. Once again, that stigma around mental illness really continues to keep the issue hidden, And the more that we as practitioners can feel comfortable discussing the mental illness